Good morning, guys. Well, it's raining, it's grey, it's cold. Well, it is the UK. Never mind. There cannot be winter without summer. Yeah, it's been a funny few months, honestly. It's been a funny 4 years, quite frankly. It's our anniversary in January. 4 years. Hasn't time flown? We've been very privileged, actually, because we've managed to grow the clinic without any pressure. I kept my out-of-hours job, and we built this practice up and scaled the NHS work down as the business grew. Shouldn't call it a business, really, should I? So it's sort of grown organically. And it's meant that we've been able to sort of learn. And that's super important. We've been open. We haven't had a fixed doctrine. I'm quite comfortable now and confident that the model we offer is gold standard. So what's a gold standard TRT model? Well, in my opinion, and we're all entitled to different opinions, in my opinion, it's daily testosterone cypionate injections, daily HCG injections, and the route of administration, subcutaneous injections. Does it work for everybody? And the answer to that is no. It works for the vast majority of people. The vast majority of people. Who doesn't it work for? Guys with incredibly low SHBs. Sometimes we've had a couple of guys that we haven't been able to get stable on cypionate and HCG. And they actually feel better on Nebido. Shock horror Nebido. But we don't use Nebido as per the manufacturer guidelines. We microdose Nebido, so they're on weekly injections, and one's on a 2 weekly injection, as in every 2 weeks, sorry. And they're very stable, actually, which is brilliant news. But if you think about physiology, natural diurnal variation, and when we think about hormones, it shouldn't be a matter of on Monday I have this level, on Tuesday I have that level, on Wednesday. Hormones don't care about the day of the week, the month, the year. They want to be stable. They want to help facilitate this process, homeostasis. So your body is working incredibly hard to maintain a stable internal environment despite external changes. Now, what do we do as human beings? We disrupt that internal environment. Whether it be through naughty things like steroids, recreational drugs, alcohol, whether it be through things that your doctor's prescribed, such as antidepressants, opiates for pain, whether you've been scrapping, whether it be in a ring or a cage or outside the pub after you've had a skinful, traumatic brain injury, all of these things cause a disruption to this internal environment. Sometimes you can recover, sometimes you can't. How long should you wait to recover? That's question's how long is a piece of string? So it's a difficult question to answer. But I think you have to appreciate that we don't have long on this earth. It's actually quite good that we don't have long on this earth, because it should actually make you think about what you are trying to achieve, what you should be trying to achieve, and how you can go about doing that in a limited time. Death is nothing to fear. It's part of life. Fear is an abnormal reaction. We shouldn't be afraid. I will start chanting now. Been listening to a lot of Alan Watts and Zen, and yeah, it puts things into perspective. Bruce Lee, be like water. Take the shape of the cup. It's very true. So when there's hate, there's love. When there's darkness, there's light, etc., etc. So just be present in the moment and appreciate the moment. Why am I getting all philosophical? I'm getting philosophical because we're always under attack. We're under attack by NHS endocrinologists who do not subscribe to the BSSM guidelines, despite obviously them being written by endocrinologists and GPs, and despite there being an European consensus, and despite all the evidence suggesting that it's safe and effective, there's a cohort of endocrinologists, mainly in Wyoming, Newcastle, they're very resistant to this idea of testosterone replacement therapy or testosterone deficiency, without establishing an organic cause, without really understanding the word idiopathic and risk factors. And there's actually there's lots of documentation to suggest, obviously, that the effects of these risk factors are permanent. How long should you wait? 6 months, 1 year, 2 years? You'll eventually recover, or it's a tainted supplement. My God, scary stuff. So we face constant battles with them. So we've faced 2 GMC investigations. We're currently going through one now. Again, our practice is open and transparent. It's open and transparent for a reason. We want to change practice. We want guys to have access to safe and effective care. So these outdated manufacturing guidelines, these outdated monitoring principles, not even considering SHBG, estrogen, scary stuff. So yeah, we're constantly fighting them. Who else are we fighting? We're fighting the competition. Now, it's funny, isn't it? Because testosterone deficiency, there's a silent epidemic. So many people struggling. So why are we fighting? We're fighting because they're bozos. Oh, I'm not going to ruin this video. Let's not ruin this video. Yeah, so testosterone deficiency is a medical condition. TRT is a medical therapy. It should be handled by doctors. I'm not going to say anymore because this will destroy the video. It should be it shouldn't be treated as a business, even though obviously the Men's Health Clinic is a private medical clinic. We always have the best interests of the patient at heart at everything that we do. So what have they done? They've made a complaint to the GMC. It was obviously anonymous because he didn't want to be named. We know who you are. We've had an anonymous concern to the CQC. Again, they hid their email and the CQC IT department couldn't track it. Isn't modern technology wonderful? We've had numerous emails, fake emails, trying to trip me up. So queer. Well, you can't trip me up because we always advocate safe and effective practice. So you trying to dangle a carrot in front of me to say, oh, will you sell me vials, 20 vials, will you, I can't even remember what they are now, but because it doesn't actually matter, because my response is always the same. So it doesn't matter what you say. So yeah, your endeavours are pointless. We've had our website cloned, the homepage. So we obviously didn't rank on Google. We've had our statement of purpose plagiarized. Fortunately, we found out, and obviously, all I did was contact one of the guys from one of the online companies, and he did take it down. We've had all sorts. It's what else? Oh, there's a Facebook group that promotes superphysiological levels and advocates microdosing of anabolic steroids and all sorts of shenanigans. They've been recently making lots of offensive. I'm not offended. I couldn't care less what you say. What am I, a clown? I'm a dick. I'm a twat. I'm all sorts of names. Oh no, you're calling me names. I don't know if you're trying to goad me into replying, but I haven't got time. This is why I do these videos in the car. I've got to. I've only got 2 minutes. I've got to get to clinic. I have patients. I have people that I need to help. What we should be doing is we should be actually trying to affect a positive change to not only the individual, but also to the collective. But how do you go about doing that? You actually go about doing that by affecting a change to the individual. So opinions may vary. Attitudes are clearly different between clinics here in the UK and different countries, and especially obviously across the pond. America's wonderful. I love America. It's big. It's brash. It's a wonderful place to visit, and they have a lovely attitude. Well, some people have a lovely attitude. Have a nice day. It's a rather sort of peculiar phrase to us Brits, and it shouldn't be really, because I think it was Johnny Rotten. He spent some time in LA, and he was like, I just can't get my head around these guys. Have a nice day. But then he actually realised that they actually meant it. So projecting positivity is essential. It makes sense, doesn't it? But some of their attitudes are quite shocking. It's all about one-upmanship. It's all about being the big cheese. Whereas we've got a Facebook group called TRT in the UK. And that whole purpose of that group is not to be the top dog. It's not to gain recognition. It's not a sales consumer relationship. It's a group of guys that want to affect a positive change to their own health and the collective. So we want to change practice, and we can only go about doing that if we all subscribe to the same mantra and the same philosophy. And that is, the group is not about changing protocols based on one study, changing your whole. I think some people miss the point of the group. Well, the Americans miss the point of the group. Opinions may vary, but we should be coming together and realizing that we need to establish balance. And I think that gets lost a little bit. A lot of guys have struggled for a long time. They've struggled with the low symptoms of low levels, such as low libido, low mood, anxiety, depersonalization. And when they find testosterone, it's seen as the golden ticket, and it's like they can get a semblance of normality back. But they're seduced by the other cohort that use testosterone, so the bodybuilders. Now, bodybuilders only use anabolic steroids in a 12-week cycle. Well, why is that? It's because even they realise and recognise the physiological insult of supraphysiological levels. Now, there also is an argument about the fact that testosterone levels have dropped, so you can justify supraphysiological levels. It's very boring. I've spoken about it before, so I'm not going to talk about it again. But you get seduced into that idea that you can be better. Now, your DNA wants you to have a certain level. I said this to the guy yesterday, and the guy yesterday quite liked it. You're designed to fight and fornicate. I like that. I think that's quite cool. Well, you are, you know. Fighting and fornicating. It's about passing on your DNA to a certain extent. But the premise behind TRT in the UK is actually normality. It's about balance. I quite like that Indian Cherokee story about the dark wolf and the white wolf. And I think that's super important, because you can be lured into that path, but I think what we really need to do is recognise, what do you want to achieve? Is it normality? If you want to achieve normality, you have to feed the white wolf.